Hello and welcome to our channel. This video is for medical students and medical professionals. Today, we are diving into an important topic concerning maternal health: pregnancy-induced hypertension, or PIH. This condition is a significant concern for many expectant mothers and health professionals alike. Let's explore what it is, who is at risk, and how it can be managed. Pregnancy-induced hypertension, also known as gestational hypertension, affects approximately 5 to 10% of pregnancies worldwide. In Sri Lanka, around 7 to 10% of pregnant women develop this condition, making it a significant public health concern. Certain populations, such as African, Asian, and indigenous communities, experience even higher rates of PIH. But what causes PIH? It mainly occurs due to poor placentation, meaning the placenta doesn't develop properly, which leads to reduced blood flow, causing hypoxia. This results in the release of factors that damage the endothelial lining of blood vessels, leading to high blood pressure and potential organ damage. When left untreated, PIH can escalate into severe conditions like preeclampsia or eclampsia, posing life-threatening risks for both mother and fetus. Certain women are more at risk for developing PIH. This includes first-time mothers, those with a family history of pregnancy-related hypertension, and women carrying twins or triplets. Additionally, mothers with pre-existing conditions like diabetes, chronic hypertension, or kidney disease are also at higher risk. Women over the age of 35 and those with pre-pregnancy obesity are particularly vulnerable. Screening for hypertension during pregnancy is a vital aspect of antenatal care. According to the World Health Organization and the Sri Lanka College of Obstetricians and Gynaecologists, monitoring blood pressure should start from the very first antenatal visit. Blood pressure checks are recommended during every antenatal appointment, as PIH often develops after the 20th week of pregnancy. It's also important to monitor women postpartum, as hypertension can persist even after delivery. Pregnancy-induced hypertension is diagnosed when a pregnant woman's blood pressure reaches or exceeds 140/90 mmHg after 20 weeks of gestation, without any proteinuria or signs of organ damage. Unlike preeclampsia, PIH usually lacks severe complications unless it's left untreated. However, PIH can lead to significant complications if not managed properly. It may progress to preeclampsia, placental abruption, or necessitate early delivery. Fetal complications can also arise, such as intrauterine growth restriction, prematurity, and in severe cases, stillbirth. Now, let's talk about managing PIH. Unlike other forms of hypertension, lifestyle modifications such as salt restriction or increased physical activity have limited impact. However, certain pharmacological interventions are effective. Medications like methyldopa, labetalol, and nifedipine are commonly used to control blood pressure during pregnancy. These drugs are generally considered safe and help keep hypertension in check. Frequent monitoring of maternal blood pressure is essential for women diagnosed with PIH. The goal is to maintain a systolic pressure below 140 millimeters of mercury and a diastolic pressure below 90 millimeters of mercury. Regular urine tests help to check for proteinuria, which could indicate worsening of the condition. For fetal monitoring, regular ultrasound scans are crucial to assess the baby's growth and detect any signs of intrauterine growth restriction. Doppler studies are often used to evaluate blood flow to the placenta and identify early signs of fetal distress. Pregnancy-induced hypertension not only affects women during pregnancy, but can also have long-term implications. Women with PIH are at increased risk of chronic hypertension and cardiovascular diseases later in life. Babies born to mothers with PIH may also face long-term health challenges, particularly if born prematurely or with low birth weight. Preventing PIH starts before conception. Pre-pregnancy counseling, weight reduction, and regular monitoring of blood pressure are crucial. Starting low-dose aspirin early during pregnancy can also help reduce the risk of developing hypertensive disorders. Pregnancy-induced hypertension is indeed a complex condition, but with timely screening, effective management, and preventive measures, its risks can be minimized. If you're expecting or planning a pregnancy, always talk to your healthcare provider about your risks and ways to stay healthy. Thank you for watching. If you have any questions, please let us know through the email address given below.